So Ayushman Bharat is a historic opportunity. This is the next level of healthcare, which is organized on a platform of health and wellness centers, and then covers the primary health care, the secondary health care, and the tertiary care. So this is the principal vehicle for achieving universal health coverage, which will ensure that citizens of this country are able to access quality health care in an affordable manner. Now, if you heard the finance minister's speech, so we're going to create 1,50,000 health and wellness centers. So our sub-health centers and the primary health care centers will now be transformed into health and wellness centers. Now, what is different between an existing sub-health center or PHC and a health and wellness center? So the health and wellness center will provide comprehensive level of primary care. So far, we were providing selective primary care, largely limited to RCH care and care relating to communicable diseases like TB, malaria, etc. But the care in relation to non-communicable diseases, mental health, etc. was generally not available. So the health and wellness centers will provide much wider band of services, including non-communicable disease. The second difference is a big focus on prevention and health promotion. So there will be like universal screening for non-communicable diseases, identifying risk factors, creating health promotion, involving yoga, etc. at these health and wellness centers. So that's another important element. The third thing is in terms of the entire organization of healthcare. So today, if we look at healthcare, it is fractured care. You go to a facility, they provide you a care, and they may request you to come back again after a fortnight or so. What we are now looking forward to is the entire organization of healthcare, where the primary healthcare system works in a manner that they identify cases which need to be referred to secondary or tertiary care, and then these under NHPS such cases get addressed. They receive free care under the National Health Protection Scheme at the secondary and tertiary level, and subsequent follow-up of these cases happens again at the primary health care level. So to give you an example where we have been able to operationalize some of the health and wellness centers, that at the district hospital, the medical specialist identifies a patient of hypertension and then prescribes certain drugs. The entire follow-up then happens at the PHC or the health and wellness center at the sub-health center level, where they monitor whether the hypertension is under control and then are able to dispense drugs. We are also making big use of technology, so there will be a point of care diagnostics at these health and wellness centers, and then there will also be a mechanism for teleconsultation with a medical specialist or a doctor at the other end. So overall, it is going to be a game changer for the Indian healthcare, and it will require very large partnership amongst various stakeholders. So governments, both center, state and the local level governments have to come forward. You have the insurance companies which will be involved in a big way in terms of implementation of the National Health Protection Scheme. You will have the private hospitals which will come up in a big way. We'll also be required to provide large-scale training to our outreach workers. So there will be ASHAs, ANMs, doctors at our PHCs, mid-level care providers at our sub-health centers which are being transformed into health and wellness centers. So there will be a major upswing in terms of capacity building of these workers. A big important element of this Ayushman Bharat is a very, very robust IT backbone. So what we are looking forward to is a next generation, state-of-the-art, one of the best IT systems in the world, and we are involving the best minds in the country to advise us in terms of how to create that health system. So largely it will be like a health stack which facilitates capturing of all transactions in the health ecosystem. And so what it does is you have a whole set of registries, and then all those registries keep on talking to each other. So we had discussions with Mr. Nandan Nilekani, etc. That health stack, what we anticipate is going to take a couple of years to see the light of the day. But meanwhile, the building blocks of that are already beginning to happen. And so we are having some track 1, which is a something like 4 to 6 months duration, where we will operationalize certain modules and which will operationalize the Ayushman Bharat, and then track 2, which is a very much bigger and far sighted state-of-the-art IT backbone, which will facilitate this organization of healthcare in a continuum. Yes, so you are absolutely right. So quality both in terms of safety as well as in terms of satisfaction for the patient. So one of the things that we are going to do within the National Health Protection Scheme is that when the hospitals would be empaneled, there will be a differentiated rates for those hospitals, say, which are NABH empaneled and those which are not. So that helps for even better hospitals or high quality hospitals also to come and join NHPS. So the rates, there's likely to be a differentiated rate. That's the broad understanding that we have with the consultation that we have had with the various stakeholders, with the state governments, with the hospitals, etc. There's also in terms of building in systems where the hospitals are required to report their outcomes of performance within the hospital. So, I mean, how many patients really acquired infections within those hospitals are required to be reported. So that will again help in terms of creating much greater quality consciousness. The third is that like what we have launched is a Mera Aspatal application, where we try to capture the feedback of the patients who visit various healthcare facilities and seek feedback about their experience in those healthcare facilities and rate them on the basis of feedback of the patient. So we have more than 1,000 such hospitals under the Mera Aspatal application that the Government of India launched, where we are able to capture where patient is very satisfied, not satisfied, and then the ranking of the hospitals is created. So these are some small measures which have been initiated. Within the public health system, we have created a national quality assurance program, which is also ISQA certified NQS system that has been implemented in all the public health hospitals. And there is a mechanism for certification of NQS certification for public health hospitals, and which can also happen in a graded way, that they could take up not all the 18 departments, but some of the departments get certified first and other departments get certified later. So big drive was to get the labor rooms and maternity OT certified, then 6 critical departments: maternity care, child care, emergency care, laboratories, OT. So these would be certified in the next stage, and then all the 18 departments. So big thrust on that. See, I think funding is adequate. Let's see it in 3 ways. The rollout of the National Health Protection Scheme, I mean, it's not for all the 12 months of the year. It gets rolled out. Different states may be in a position to roll out at different times because they have an existing scheme. So there's a possibility that not all states may be able to start on the same date as some other states because they have some existing scheme and have some contracts. And the most important thing is that when we did an estimation, this is some contribution is already provided in the budget, which has been discussed. Then there's a state component there, so state share will also be there. Thirdly, if you noticed, a very critical thing that Finance Minister announced was a provision of health and education cess, which is now 4% of the income tax and the corporate tax. So earlier it was 3%, which is only for education. Now it is health and education, which has now been made 4%, which will generate additional 11,000 crores. So there is no way that we will need money, anything, I mean, that's more than adequate to meet our requirements.
Finally,
So if there is any need at the RE stage, it can always be provided for. To be honest, we have had very extensive consultations with the state governments. I am happy to say that none of the states so far has conveyed that they are unwilling to implement the scheme or unwilling to join the scheme. We found very, very encouraging response from the state governments.